We're going to use this x-ray to discuss what our options are when we have bone-on-bone arthritis to the outside part of the knee, but the rest of the cartilage in the knee looks good. It used to be, in the old days of orthopedics, what we would tell people as doctors is we'd give people shots or pills, and we would say, go back and live life, and when you can't take it anymore, come back and we'll do a thing called a total knee replacement. And what we were doing in those days as doctors was just letting the arthritis go all the way through the knee and letting that kind of knock-knee effect of the tibia happen until the whole thing was arthritic, and then we would replace the knee joint with something that looked like this, which was a total knee replacement. And it was a good procedure, but certainly a big procedure. And nowadays, frankly, we do things a little different. Nowadays, if we have someone with arthritis just on the outside part of their knee, but the rest of their cartilage looks good, we do something called a robotic-assisted partial knee. What that involves is we start with a CAT scan of your leg, and from that CAT scan we can do a virtual operation where we can replace just the very part of bone that lost its cartilage. And most importantly, we straighten your leg back to where it was when you were a teenager. And by doing that, that helps protect the cartilage in the rest of the knee. Once we have it perfect on the computer, that digital surgery can get downloaded to a robotic arm that we can use to translate it off the computer into real life. And that ends up looking something like this, with a piece that goes on here to replace the part that lost its cartilage, and then a little plate that goes on there to replace the part that lost its cartilage. And most importantly, we kind of straighten out that angle that's developing in the tibia to get the knee back to where it's supposed to be. Advantages of that robotic assisted partial knee over the old-fashioned total knee are basically three. One, it hurts less to have done. We tell people it's not a walk in the park, it's still real surgery, but people that have had an old-fashioned total knee and one of the robotic partial knees say the partial knee hurt less to have done and they recovered faster. The second key, and the one frankly that most people care about, including me, we have a much higher chance when we're all said and done of you coming back and telling me it feels like my own knee, and that's what we're after, a knee that moves and feels as close to your own knee as possible. The third advantage over the old-fashioned total knee is the risks of the surgery. The risks of the old total knees that a lot of people have heard of, those are things like blood clots, infections, heart problems, lung problems. They're much, much, much less with a partial knee, so it's a safer procedure. Time frame wise, if we're ever thinking about having that done, you could put all your weight on it right off the bat. So people start out with a walker and get rid of it as soon as they want. You move to a cane. You can get rid of the cane the minute you want. Most people feel comfortable to drive after a few weeks. After 3 months, we let people do any kind of sporting activities they want to start trying, and those can include things like golf and tennis or skiing, things like that. 6 months is kind of the end date. That's when most people say they kind of mentally feel fully recovered. The chances that you say it feels like your own God-given knee are around 94%. The old-fashioned total knee is only about 70% of people were satisfied enough where they would say those kinds of things, so much higher chance. It's a lot of information coming at you all at once. If you have any questions, feel free to rewatch the video, or certainly reach out to us with thoughts, concerns, questions, anything you might have, and we're happy to answer them. And my staff will be reaching out to you shortly to discuss next steps. I hope you have a great day.